Some of the patients we have given biologic treatment. Biologic is a very new treatment in asthma, and this has been there last 10 years. It wasn't available for asthma before that. It's a very precise treatment. It's a targeted therapy, and it does do a great job in the right patients. So I would like to invite Renu and partner, and they've been very courageous to come here today and discuss with us. So you can come to the podium, please, and share with us the journey of the biologic treatment in asthma.
I was diagnosed with asthma around 6 years back in 2017. And since then, I was very ill until I took the biologicals. I had a lot of breathing issues. I felt short of breath just by walking a little or climbing few stairs, or sometimes merely by talking. My life was limited and I couldn't do many things which I loved. Uh, I was back in India at that time. I took inhalers, nebulizers, oral steroids, and many other anti-allergic medicines also, but nothing worked for me. Then my doctor advised me to go for this biological treatment. Initially, I was very skeptical about it because it was relatively a new drug and I was not sure how the results would turn out for me. But then I decided to go for it. And let me tell you, it was absolutely worth trying, completely worth it. Uh, Talking about the results, I took 2 shots of Azarna biologicals back in India. Then we had to move to Dubai, around 2 years ago. And then here I consulted Dr. Syed, and he also, after evaluating my health parameters, advised me to continue this biological treatment. And since then, I'm taking this Azarna biological at a gap of every 8 weeks. And talking of its results, they were phenomenal. Like, it worked like a magic for me. My condition improved drastically. I could walk for a longer distance, breathe normally. Not only I was back to my routine of doing household activities with ease, but I am also, doing my morning exercise like yoga, walking, cycling, sometimes running also, which I was not able to do for a longer period of time because of my asthmatic issues. And I would especially like to thank Dr. Syed and King's Hospital, who also truly cared about my well-being, and they provided me excellent medical treatment. And above all, he gave me hope that things could get better for me with this treatment. So in a nutshell, I can say that as of now, I am living a completely healthy and normal life and extremely happy about it.
But I remember on a radio telecast when you joined in, you did tell that you were doing some marathon race or something like that. So it's this amazing transformation for somebody who cannot walk into my clinic is doing marathon race and run. So modern treatment, but again, good care and all that does help. And at King's, I'm very privileged to have all the facilities that we need, like including pheno testing, which is very essential. We touched on that. The spirometry, the IgE, the allergy test. We did allergy testing for you as well. Yeah, so this is all available at our setup in King's, and it's a very, very useful thing. Yeah, sometimes I feel that, I could not get those deliveries in UK when I was doing a clinic that I can do in my King's clinic. So I do feel privileged, and Kimberly's here.
One more thing I would like to add, like Dr. Syed also introduced me a support group, which ensure that I get my medication every time at the comfort of my home, and I don't have to rush to the hospital to get myself injected every time.
So that's very good because she doesn't have to come to the clinic. She has this medication that she takes 2 months, 3 months usually from the clinic, or we send it to her. But the biologics are delivered at home, and normally patient learn to do it. She has been a bit frightened to do it. Normally our patients are doing it at home. So, but again, it does matter because, somebody who could be requiring steroid would have balloon faced, would have had diabetes, a miserable life. And unfortunately, wrong treatment, these things all and going into one hospital to another hospital.
Hello, everybody. My name is Zara Hamirani, and my job before I got asthma was to be a corporate lawyer and to speak all day in front of the courts. It was August 2019, and I had never really gone to the doctor. I wasn't really sick. I was 47 years old. I'm an active mom of 3 kids, and I never really took time to do anything. And all of a sudden, I got so sick that I just couldn't get out of bed. And everyone said, you have COVID. And I remember that time when nobody really knew what that meant. You would actually go to the doctor and say, oh, take a COVID test. It was negative. It was negative for weeks and weeks. Later on, the antigen test told me I was positive at some point. But it was at that time that I started to realize that, I need to take my health seriously because it became a trickle effect for so many other things. I would eat certain foods and I'd break out in hives. I would go outside, I ride horses, I do boxing, couldn't do those things. I'd go to the polo field, we live on the polo field, and I would actually turn red as a tomato. So my quality of life really, really changed. And I started to say, okay, what do I need to do? I was on Clanase and Allegra and Zyrtec and all sorts of over-the-counter stuff. And then finally, I actually decided that I was going to seek professional consultation beyond just taking antibiotics and that. And I started at King's College Hospital seeing a doctor named Dr. Asif Sattar, and he started putting me on Foster and the blue asthma medication and the red asthma medication, and I started doing it. But I was one of those patients who I got a little bit better, and I stopped doing it because I thought, oh, I'm traveling. When I'm in New York, I'm fine. When I'm in London, I'm fine. It's only when I would get home that I'd start to feel sick again. So I was one of those patients that actually said, okay, I'm fine, I'm okay. And then I came and I met Dr. Syed Husain, who one day sat me in his clinic and spoke to me for probably a good 40 minutes, giving me a lecture, much longer than I should have been there, and telling me how important it was for me to actually breathe in and use that sort of glass container to actually take the asthma medication all the way into my lungs. It was the first time somebody had actually explained to me that this is what I needed to do to ensure that I start feeling better. And I can tell you, it's now been about 3 years. I started getting on Fasenra probably about 14 months ago, and that's changed my life. I mean, I had phlegm every single morning. I was constantly sick. And I would say after just maybe 2 treatments of that to 3 treatments of that, I started to feel so much better. So one of the things that I actually do now is I'm back on my horse. I'm able to go boxing. I'm back at work and I'm doing different things, which has become a real change in my life, which is why when he asked me to come and speak, I wanted to share that it is important because sometimes as adults, we don't take the time to look into symptoms for the long term or make changes in our diet and make changes in our lifestyle. But I think with doing the combination of medication and those things, there really was a big transformation. And I'm pleased to say, I'm now 50 years old and I feel better than I ever felt before. So that's my story. Sure.
So tell me, are you injecting yourself at home or not?
I'm able to. So you've taught me how. Yeah. And the last time I came into the clinic, because I had to come back just to get the prescriptions redone, I did it in front of you by myself.
So this is the magical thing about this treatment, that people don't have to be in the hospital, though for cautions and for taking it very seriously, because these patients can have allergic reaction to this injection. So it can be very serious. So we make sure the first 2 or 3 times we deliver it under our supervision in the hospital. And also we make sure that the patient stays after this for 45 minutes to an hour. So we said that biologics do work very well, and you're having a normal life because of the biologic treatment. And you know how to inject it, though the first 2 or 3 doses we gave it into the hospital, made sure there was no allergic reaction, and then you went home. Professor Basim is going to enlighten a bit more about the biologics, but this is again story of success that we have locally here, our patients benefiting from biologic treatment.
My name is Will Smith. I come from Houston, Texas. Taking back to my first part of my journey, early on in my years, I had pleurisy from being outside as a kid and playing grasses. Then towards my early years of college, I got my first lung collapse, spontaneous pneumothorax. I've had 6 of those. And then last year, I caught COVID for the first time. And I started having real breathing problems. I was here in 2019. Because of the pandemic, I had to go back home. My pulmonologist in Houston, Texas, we went through a lot of tests, found that I have pulmonary fibrosis. From there, we put me on a medication and steroids to help me get through that. When I moved back to Dubai, because my wife works here, I looked up pulmonologist and found Dr. Syed. Because of the dust and sandstorms here, I needed something extra to help me get through those times when I wasn't breathing so well. And he introduced some steroids, some inhaler steroids, and also a Respimat. And the combination of those two have helped me breathe a lot better, helped me get through a lot of situations. One of the main things, though, that I have to say when I stand up here for you, that it's the combination of positive energy and having the right knowledge that lessens the anxiety, which lessens the entire situation that you're going through. I have found that having that calm peace of mind that what you're doing is actually working alleviates a lot of everything else. It's just the positivity and having what your doctor's saying actually working. So that's my story.
I appreciate you coming from Houston, Texas, seeing one of the best pulmonologists and best hospitals, and then coming to us. How did you find the care at King's College Hospital in Dubai?
Well, unbelievable, because my family goes back into healthcare a lot, especially Methodist Hospital. So I've been around healthcare for a long time. So when I came here, I was looking for a pulmonologist with experience who understood where I came from and what I was dealing with. And I found that in the hospital. In going to the hospital, an amazing facility, period. And I've seen a lot of hospitals. Just the environment. To me, I go back again to that. It's the environment helps so much with patient care and how they feel when they're in the environment. That's one of the things that Methodist Hospital believed in when they first opened the hospital in Houston, is like, we want that hotel experience when you walk into the hospital, not the white, sterile. You have to feel good when you come in here because these people are coming for care. And so I felt that when I came there.